So today I would like to present a work I completed at Towson University with one of my doctoral students, Reem Al-Shinafi, and my colleague, Nam Nguyen. As Jonathan mentioned, lots of my research have multifacets and is highly interdisciplinary. And I find it extremely beneficial to collaborate with colleagues from different backgrounds. So Nam Nguyen is a faculty specializing in data science and social media analysis. And Reem grew up in Saudi Arabia, was actually a faculty in Saudi Arabia and pursuing her PhD in the US. And the three of us all together, we came up with this interesting project that focused on understanding social media usage related to cognitive disabilities in the Arab region. And we all are very glad to have this opportunity to share our work in the HCIL Brown Bag launch series. And we'd love to hear your questions and input after the talk. So a really quick background about the motivation of the work. So cognitive disabilities are difficulties affecting cognitive functions such as learning, communicating, attention, memory, etc. And cognitive disabilities are by far the most common type of impairments compared to motor impairments or perceptual impairments. In the US, more than 10% of adults live with cognitive disabilities, and disability prevalence rate is expected to be higher in developing countries. However, usually the prevalence rate reported in developing countries tend to be lower than Western countries because of various reasons, such as underreporting and underdiagnosis. There are lots of evidence that confirms the substantial value of social support and communication and community belonging for people with disabilities and their caregivers. However, in the real life, that type of support is very commonly to be insufficient because of limited resources or social stigma, especially in developing countries. And a very quick overview of several previous work that shows social media platform can help fill in the gap between the need for social support and communication and the limited resource in real life. So DHealth found that parents of children with special healthcare needs, they can best learn about their children's condition and overcome challenges through parent-to-parent communication. And that type of communication has been increasingly done over social media platforms. Amari and Schoenbeck, they find that social media groups successfully assisted caregivers of people with disabilities in acquiring information and obtaining social support. The third paper was actually conducted by the team in iSchool at UMD. And they conducted a comprehensive analysis to show that Twitter was a very effective tool to help establishing political action and advocate for disability rights. And lastly, Amory et al. Found that individuals with disabilities and their caregivers often turn to social media platforms to overcome the challenge of offline judgment and limited resource. In the past decade, there has been a rapidly growing increase of the interest in social media in the Arab region. In Saudi Arabia alone, as of last year, there were 27.8 million active social media users, and that accounts for almost 80% of the population. As to the Twitter platform alone, as of January this year, Saudi Arabia and Egypt each ranks at 8th and 18th place, according to the number of Twitter users. And the two countries combined have a total of nearly 20 million Twitter users. Despite the huge social media users from this region, there's very, very limited research in this area. One of the very few publications regarding social media usage by people with cognitive disabilities in this region was done by Ala Mashat. She found that some individuals with ASD in Saudi Arabia use social media to connect with others and acquire information. And the level of engagement of those users largely depend on their internet access, their education level, language, and some social rules. Individuals with cognitive disabilities and their caregivers in the Arab region face some unique challenges that are not as prevalent as in the Western country, such as lack of awareness about cognitive disabilities in general, lots of cases that's undiagnosed or unreported, and then up to today, still there are many families who tend to hide their children's disability for fear of societal judgment. So with very different societal context, the findings of the literature from Western countries may not apply to the users in the Arab region. And this motivated us to conduct the project that I'm going to present. And this project contains two stages. In the first stage, we conducted semi-structured interviews to study how social media was used to support and empower children with cognitive disabilities and their caregivers, particularly in Saudi Arabia. The interview covers four categories of four topics: the general usage of social media specifically related to children with cognitive disabilities, government support available, and the role of social media during the COVID-19 pandemic. And here is a summary of the demographic of the participants. We interviewed 13 participants. Only one of them was female. Only one of them was male. And 5 of the participants were specialists working with children with cognitive disabilities. 8 were family members of children with cognitive disabilities. And we also want to point out that the education level of the participants are much higher than the general public in Saudi Arabia, where 1 out of 4 adults receive post-secondary education. However, among our participants, 12 have undergraduate or graduate degree. Therefore, the challenges observed, that we stated during this interview may be underrated compared to what children in a typical family in Saudi Arabia might experience. And we translated the interview transcripts to English. The interviews were all conducted in Arabic, and they were translated to English. And then Reem and I, we coded the transcripts according to the semantic analysis guidelines proposed by Brown and Clark. We uncovered 4 major themes from the transcripts: motivations about using social media, difficulties and challenges when using social media, opportunities for enhancements, and social media use during COVID-19 crisis. Sub-themes were identified under each of the high-level themes. For the sake of time, I will only discuss some of the second-level themes in this talk. Starting with motivation, 12 out of the 13 participants state that social media is a very, very important tool for them to seek and share information about their children's condition. Multiple participants said they immediately increased social media usage related to their children's condition after the initial diagnosis. P4 is a mother with a son with ASD who said, "Once I knew about my son's condition, I opened the YouTube immediately to get information about his disability, how to look after him, and how to enhance his case." Interestingly, multiple participants mentioned that the healthcare provider of their children encouraged them and directed them to follow reliable social media accounts. And they mentioned the information provided by the healthcare provider is critical for the adoption of social media, because initially they thought the child's healthcare provider was the only source for information about their children's condition. One participant shared her experience to use social media to self-diagnose her sister's dyslexia. So she mentioned, I learned there are cases called learning difficulties, which is what my sister was suffering from. And then I knew that there was a governmental establishment which tested her and sent her to the appropriate school. So from this example, you can see social media played a very important role in both diagnosing the condition as well as seeking for the right resource for her sister. From the privacy perspective, it was encouraging to find that a large number of the participants have very high reservation about sharing information publicly. For example, P11 has a son with ADHD and dyslexia, and she said, I don't share anything in public, but I give advice privately to anyone whom I know have children with the same condition. And the second quote was from a specialist who also expressed how she practiced. During her practice, she never shared information publicly about the conditions of the children she worked with. The second motivation of using social media is to use it as an important communication channel to connect with other specialists or family members with children with the same condition. P2 is a specialist who said, I use social media to check on the children's progress in training and learning needed skills. Similar to the concerns that we find under the information seeking and sharing theme, when communicating on social media, the participants are concerned about privacy issues and mainly communicate through private social media communities or private one-to-one communication channel. Participants also use social media to help raise social awareness about their children's condition. A very interesting quote was contributed by a specialist who shared her experience of a successful campaign to change government policy. She stated the Ministry of Labor changed the criteria of beneficiaries of the daycare services so that more than half of the children were excluded from the service. Families and specialists released a hashtag, turning off admission children with disabilities, calling for returning to the old criteria. We treated and retreated until the decision was made by King Salman to restore the old regulations. However, there are also participants who shared disappointing experience in this endeavor. P8 is a father, the only male participant of the interview study. He has a son with ASD, and he said, we need more awareness and cooperation of the competent authorities to spread awareness. I post hashtags on Twitter, but unfortunately, they are usually deleted after 2 or 3 hours because they lack the participation of tweeters. And the last major theme and motivation is using social media to build community. All 5 specialists belong to online groups where they share information and resources. In contrast, only 3 out of 8 family members belong to online groups, suggesting a potential passive engagement in online communities. So moving on to the barriers for social media engagement, privacy is by far the primary concern. 10 out of the 13 participants expressed worries over privacy or did not share information online for privacy reasons. Some participants believe Twitter was trusted more than other platforms. And again, the participant with a sister with dyslexia shared some important view of different perception about information sharing between generations. She said her family disapproved of her sharing any information about her sister's condition, both online and in everyday life. And her parents also disapprove of her sister using any types of social media platform. And she said, although she has different views regarding information sharing, what should and should not be shared, she respects her family's view, and she stopped sharing any information about her sister's condition or asking any questions about her sister's condition on social media platform. Another barrier I would like to mention here is the impact of public judgment and negative comments on the family with people with cognitive disabilities. And we listed two quotes here, both from parents with children with ASD. I don't want to read them here because of the time limit. Participant 4 actually told us that although she participated in online communities and knows several parents with children with the same condition of her son, when she had questions about ASD, she usually just tried to find information on through YouTube videos rather than asking questions for those other parents. The other three barriers uncovered are misinformation, lack of resources, especially Arabic materials, and the design of technology. Again, due to the time limit, we won't dig into them in detail. With the knowledge uncovered in the second stage, we move on to the uncovered in the first stage, we move on to the second stage, where we would like to gain broader understanding on Arabic traits related to cognitive disabilities through text mining and social media analysis techniques. We chose Twitter as the platform of data collection for three reasons. First, Twitter is one of the three most popular social network platforms in the Arab region. Secondly, our participants in the interviews considered Twitter as the most used and suitable platform, especially for advocacy and public discussion. And thirdly, Twitter is an open forum that incurs less ethical risks. And for example, compared to WhatsApp, tweets are typically public. When the user tweets a message online, the original intention, they are aware of that it's public. But on WhatsApp, lots of the conversation happened in private groups, but those conversations can still end up in the public group due to the message forwarding function. And through the entire data collection and analysis process, we closely followed ethics guidelines for conducting research with publicly available data. We used Twint to script Arabic tweets related to cognitive disability from a 9-year period of time, starting from March 2012, which it was when Twitter was first available in Saudi Arabia. The keywords we included in the search are from 5 categories: autism, spectrum disorder, Down syndrome, ADHD, learning-related disorder, and general unspecified category. The keywords were chosen based on the practice and perception about cognitive disability in the Arab region. For example, in the Arab region, learning-related disorder typically only include 3 conditions listed here: dyslexia, dysgraphia, and dyscalculia. And some of you might be thinking right now, for example, why dementia was not included in the search keywords. That is because typical aging-related conditions such as dementia were not perceived and reported as cognitive disability in Arab countries. And that's why we didn't include those conditions in the search. This chart illustrates the data collection and analysis workflow for stage 2. After the tweets were collected, we conducted volume analysis and temporal analysis directly on the Arabic traits. And for sentiment analysis and topic modeling, the process was more complicated. There were two ways to do it. One is to use Arabic natural language processing tools to analyze Arabic traits directly. The other is to use machine learning to translate the Arabic traits into English and then use English NLP tools to conduct the analysis. Previous work suggested that existing Arabic NLP tools are far less mature and validated compared to English tools. There are also work that provided empirical evidence that analysis done on machine translated Arabic traits using English NLP tools outperforms or achieved the same level of performance as Arabic NLP tools. Therefore, we chose the second approach. We translated the Arabic traits using Google Cloud Translation API, pre-processed the translated traits using the NLTK toolkit, and then conducted sentiment analysis using VADA, the Valence Aware Dictionary and Sentiment Listener NLP tool. And then finally, topic modeling was conducted using the LDA model, latent Dirichlet allocation model. I'll start with the overview of the data set. The data set contains more than 837,000 tweets, containing more than 79,000 unique hashtags. And the tweets were contributed by more than 276,000 unique Twitter accounts. Regarding the image multimedia usage in the tweets, 23% of the tweets contains images and 3% of the tweets contain videos. The percentage of tweets containing multimedia materials is actually pretty encouraging because it's comparable or even exceeded than the statistics reported in other publications about English tweets or tweets in other languages such as Portuguese. And we know that tweets containing multimedia materials are more likely to be liked and retweeted. So it's pretty encouraging to find more than 20% of the tweets actually contain multimedia materials. We further broke down the number of tweets across the 5 categories of cognitive conditions. From figure 3, we can see that 40% of the tweets were about ASD, 25% about Down syndrome, 22% about learning-related disorders, and then 10% about unspecified general conditions, and lastly, 2% were about ADHD. When we connect the percentage distribution of the number of tweets across the 5 conditions with the prevalence rate of those conditions, some interesting patterns emerge. Figure 4 shows the estimated or reported prevalence rates of 4 conditions in Saudi Arabia, Egypt, and US. And we can see that autism and Down syndrome has much lower prevalence rates as compared to learning-related disorders and ADHD. However, in our data set, ASD and Down syndrome has much more tweets compared to learning-related disorders and ADHD. And we also broke down the tweets according to per year. And 2012 and 2021 should be ignored because data is not spanning the entire year. 2016 is an interesting year because it has abnormally high number of tweets, which we will explain in the next slide. And between 2014 to 2019, we can observe a consistent increase in the number of tweets about cognitive disabilities. And then there is a sharp decrease of tweets about cognitive disabilities in 2020. which we suspect was related to the outbreak of the pandemic, which draws lots of attention from other topics. In figure 6, we demonstrate the average number of tweets from about each condition across the 9-year period. It's interesting to see the spikes on the curves about Down syndrome, about tweets about Down syndrome, and the tweets about autism. Most of the spikes are attributed to advocacy campaigns or government announcement. For example, the highest spike on all the curve occurred in March 2013, and this sudden increase in number of tweets about Down syndrome was due to the posting of a tweet of a hashtag with Down children by a very popular Twitter account the day before the World Down Syndrome Day. And then it's interesting to take a look of the spikes on the tweets regarding autism. Those 4 tweets were all due to the advocacy tweets about the World Autism Awareness Day. And however, the spike that happened in September 2016 was the result of a public protest against a newly announced government program, the Educational Voucher Project. This project was announced by the Ministry of Education in August 2016. It offers government grant to support children with disabilities to attend special education schools or special education programs. So the intention was good. However, the enrollment criteria was very exclusive. Therefore, the public turns to Twitter and other channels to advocate for the educational rights of all the children with disabilities. And eventually, some of the enrollment criteria was adjusted later on. And next, we studied who were actually actively leading the conversations about cognitive disabilities on Twitter in this region. We manually analyzed the top 100 most active Twitter accounts in our data set. The result was several categories under individual accounts and organizational accounts. I'll just point out some interesting numbers here. Among individual accounts, special lists, 27 of the accounts belongs to special lists, and only 5 belong to individuals with cognitive disabilities. Among the organizational accounts, most of them belong to nonprofit organizations, while there was only 1 account that belongs to government. The low number of active government accounts is actually in line with what we observed during the interview. Multiple participants said they were unaware of government efforts and government programs that can help improve their children's condition. And we also manually analyzed the top 100 most active Twitter accounts that specifically tweets about ASD. And we compared the results with the work published by Ballon and Harn that studied English tweets about ASD. And the most interesting finding is the difference between the number of accounts that belong to individuals with ASD. In the English tweets dataset, they reported 10 accounts among the top 100 active accounts about ASD, while in our datasets, only 2 accounts actually belong to individuals with ASD, again suggesting low level of engagement of people with disabilities on social media platform. And next, we studied the opinion of the Twitter users about different types of cognitive conditions. We start with the general sentiment, the general number of tweets that are positive, negative, or neutral for the entire data set. And we can see that about half of the tweets were actually positive and almost double the number of negative tweets. However, when we break it down to 5 different categories, you can see different patterns for different conditions. There are much more positive tweets than negative tweets for ASD and Down syndrome. In contrast, there were much more negative tweets than positive tweets for learning-related disorders and ADHD. And these 5 curves shows the average sentiment score per month for each of the 5 conditions. And we can see that the sentiment score fluctuates, but typically stayed pretty stable in the 9-year period of time. And then we then combined all 5 curves into one curve so that we can observe the comparative position of the curves. You can see the sentiment score of Down syndrome is the highest and almost always in the positive range. And then, the scores of unspecified conditions and autism are very close and also mostly in the positive region. The sentiment score of the ADHD was actually the lowest, almost always in the negative range. And the negative public perception about ADHD and learning-related disorders needs further examination. And we are planning to collect more data and take a closer look of those traits to figure out the cause of the negative perception about those 2 categories of conditions. And lastly, we used the LDA model to find out what people are interested in when they are engaged in conversations about cognitive disabilities on Twitter. The LDA model, in the LDA model, you need to set the number of topics you want the model to classify. We select the number to be 15 to balance between possibility of missed topics or repetitive topics. And for each of the 15 topics classified by the LDA model, it provides a list of the top 30 most relevant terms for that topic. Also, together with both the global frequency and the local frequency of that term. For example, if you look at the blue bar and the red bar right next to the term learn, the blue bar represents the frequency of the term learn in the entire data set. So learn is by far the most frequently used term in our data set. And it is also the most frequently mentioned term for topic 1. And you can also see that, so the theme about learning is not only discussed in topic 1, but appeared in many other topics. In contrast, if you take a look at the bar next to the term government, the length of the red bar and the blue bar is very close to each other, suggesting that the term government showed up primarily under topic 1 and was rarely mentioned in other topics. So based on the list of the 30 most relevant terms and their frequency, we summarized and proposed a title for each of the 15 topics classified by the LDA model. And the top 3 topics are education related with a broader focus, meaning it not only talk about school-related stuff, but also government, social centers, etc. And the second most common topic is education with a school focus. And the third one is regarding government-related issues. The LDA model also provides an intertopic distance map that shows how the topics relate to each other. On this map, the size of each circle represent how common that topic emerge in the database. And the distance between the circles represent how close the topics are related to each other. We can actually observe two clusters of topics. The first cluster is in the mid-bottom area on the map. It centers around topic 1, education with a broader focus, and is closely related to 3 other topics, namely topic 2, education with a school focus, learning-related challenges, and intervention. The other cluster is in the top middle range of the map, area of the map. It's centered around topic 6, community unity, and it's closely related to 4 other topics: family, information dissemination, health, and positive emotion. So the identification of those topics and the topic clusters can provide helpful guidance and insight to government, nonprofit organizations, educational institutions about what are the primary concerns of the community of people with cognitive disabilities, so that they can better allocate resource and develop better guidelines or policies. And lastly, we tried to map themes uncovered in the interview study and the topics identified by the LDA model. You can see that multiple topics identified in the LDA model can be mapped into the themes, sub-themes uncovered and the motivation. And for the difficulty and challenges themes uncovered in the interview, some of them does not have any corresponding topic based on the LDA analysis. For example, privacy, which is not surprising because people with high privacy concerns typically end up being passive observers on social media platforms. I'll just use the rest of the couple minutes to talk about what we learned from the project and some idea for future research. One of the primary concern or barrier for the social media usage is privacy. And that's the result of both the interview study and the text mining study. And we propose that from the government perspective, legislation to protect privacy and rights of people with cognitive disabilities and their caregivers will be crucial. And funding to support training and educational programs on security and privacy would also be very helpful. And from the technological perspective, for researchers and practitioners, developing and including accessible tutorials about security and privacy protection functions offered on social media platform will be very helpful. Specifically, especially if they can be integrated into the enrollment process on social media platforms. Secondly, tools that can allow users to easily remove the self-disclosed information previously would be a very effective protection tool. Because in many cases, people with disabilities might reveal their sensitive information during campaign to better advocate for their message. But later on, those information may cause harm to those users. And a tool like this will be very helpful in protecting their privacy. And further down the road, AI-based tools that can allow the real-time detection of sensitive and private information when the user enter a message and request confirmation before posting would also be a very helpful tool for users with disabilities. And to battle other barriers, such as lack of resources, social stigma, the government agencies can develop guidelines and provide funding to develop accessible social media content in Arabic. And they can be more actively involved on social media platforms to publicize government efforts and resources. However, due to the digital divide, there are also a large number of families in the Arab region who still do not have access to social media platforms. Therefore, it's important for the government agencies to balance between offline and online efforts to spread awareness. And furthermore, organizations and specialists can play important roles to encourage active engagement in online communities. To summarize the major contributions of our work, so we provided quantitative evidence that confirm government initiatives and awareness campaigns helped promote awareness of cognitive disabilities through social media in the Arab region. We collected statistics about the distribution of traits across conditions, which helps understand public attention and help the development of policies and the allocation of resources. And lastly, the finding about public opinion and topics of interest regarding cognitive disabilities, again, can help the development of government policy, can assist in resource allocation, and can also serve as useful comparison benchmark for future research. The major limitations of our work are the errors introduced during the machine translation stage. For the long run development of mature and well-validated Arabic NLP tools would be very helpful for this line of research. Our research only focused on the Twitter platform. The other platforms, research on other platforms will provide helpful insights. But keep in mind that collecting and analyzing data from platforms such as WhatsApp can incur much higher ethical risks. That should be taken into closer consideration. Other ideas for future work include analysis on specific user needs, such as locating services, supporting diagnosis, and detecting negative discussion on social media. So those topics are also is worthy of future attention and future work. And that's the end of my talk. Thank you so much for attending, and I look forward to hear what your inputs and your comments on our work. Thank you.